So from the front, this is where you get to notice how the frontal gyri are oriented longitudinally, no? Going towards the frontal poles here. So as mentioned, all the other sulci that you will find are never really complete. They are inconsistent. So no point losing your heads looking for them. Okay, so that's the constant Sylvian fissure. That's the olfactory sulcus, which contains the olfactory nerve. Okay, and just completing the picture, the three frontal gyri and the orbital gyri and the straight gyrus. This is your frontal lobe. What about the parietal? So this now behind the central sulcus is your post-central gyrus. So there will be an inconsistent sulcus behind it, the post-central sulcus, so which makes finding the central sulcus a lot easier because it doesn't really mirror that central sulcus here. It's usually incomplete. As you can see, it stops right here. It doesn't touch the interhemispheric fissure. So just schematics. That's the post-central gyrus. So inconsistently, the size will differ among brains. We know it's not frontal because it's not directed longitudinally. It follows your pre-central gyrus going down towards the Sylvian fissure, but it doesn't touch the Sylvian fissure usually. So post-central gyrus, which I showed you earlier, subserves the light touch and the pain. So that's where all the pain is felt when you're in pain. Okay, so varies. Results will vary among brains. So that part here, since the parietal lobe is notorious, it's really hard to demarcate it. There are no hard and fast sulci there to tell you where it is. Only the central sulcus will help you find it. So you can subdivide it sort of into lobules. So within the lobe, you'll have smaller compartments or regions, which we call lobules. So this area closer to the midline is your superior parietal lobule. So you'll see it's very inconsistent. The only thing consistent is where it is up here. There will be a sulcus there, which is running from frontal to occipital. So that's the demarcation of the superior parietal lobule from its partner down here, the inferior parietal lobule. So that important sulcus over there is consistent. It has a important function. It has to do a lot with your visual attention. So paying attention to what's in front of you. So it works hand in hand with another attention area in front. So choosing where to look and how to look at it, all in the same area over here. So look at it from the side. The way to demarcate the inferior parietal lobule is actually to use the Sylvian fissure, because unlike the superior parietal lobule, the inferior parietal lobule consistently has two gyri, both separated by a sulcus here. So the angular gyrus and the supramarginal gyrus are the two gyri found within the inferior parietal lobule. And we will use two sulci, the Sylvian fissure and a sulcus here within the temporal lobe. So to find the supramarginal gyrus, so above the margin, so above the Sylvian, is this supramarginal gyrus by following the Sylvian fissure with your finger until the Sylvian fissure stops. Where it stops is where you'll find supramarginal gyrus. Whereas another one, since we'll be discussing the temporal lobe in a while, is found by following a prominent sulcus here within the temporal lobe, which is parallel to the Sylvian fissure. If you follow that, it ends up in this lobule beneath that intraparietal sulcus. That is your angular gyrus. And for your dominant hemisphere, this is actually the part of your brain that makes sense of what you're listening to. So the angular gyrus. So we will revisit these structures again so that you'll get a complete grasp of what's going on in your brains. Look at it from the top. So that now comprises your parietal lobe, which will have a inconsistent. So the reason why the parietal lobe is somewhere around here, because you only have a few markers for it. One of them is found better by looking at it from the inside, the so-called parieto-occipital sulcus, which will now demonstrate demarcate, separate the parietal from the occipital lobes here. Okay, so looking at it from the top, so results may vary. So the post-central gyri will be bigger or smaller depending on the individual's experience. That's the post-central gyrus. Technically, we're looking at the superior parietal lobule from this angle. Behind it, I'm sorry. So this is the post-central gyrus, and that's the superior parietal lobule behind it with this prominent sulcus here, which is your IPS or intraparietal sulcus. In that intraparietal sulcus, for visual attention, separates the superior parietal lobule from the remainder of the parietal lobe, which is better seen from the lateral aspect. Okay, and that's your parieto-occipital sulcus, which is better seen from the medial surface here, which we'll look into in a while. So that's your occipital lobe by mental subtraction. So as you will see later, all of these are constructs. These are imaginary. These are not real. It's just that they are consistent. Some areas, that's why we call this occipital lobe. This is frontal lobe, more or less, using what is given us here. So schematic now for the parietal lobe. A transverse gyrus here from apex, from vertex to ear. This is your post-central gyrus, and you have longitudinally directed parietal lobules, the superior one and the inferior one. And the inferior one can be further subdivided into a supramarginal gyrus and an angular gyrus. So if you're looking at this brain now, based on what you have learned so far, if you're dealing with the parietal lobe now, so we use the Sylvian fissure over here, follow it with your eyes where it stops. So where it stops, you see this gyrus over here. This gyrus, where it stops, is the supramarginal gyrus. Then if you follow this sulcus over here, you follow it all the way until you're out of the temporal lobe already, then you see a gyrus here. That's the angular gyrus. So much of how I've been teaching you so far is all about blocking out the rest so that you can focus. So that is the whole purpose of learning for the very first time, focusing on certain things by blocking out everything else. Attention. So completing the coloring book here, using those imaginary constructs, which we call sulci, and some very real ones, such as the Sylvian fissure. You can and that fairly consistent intraparietal sulcus, mentally coloring in the areas. So the precentral gyrus, the postcentral gyrus, the superior parietal lobule above the IPS, the inferior parietal lobule, which is where the Sylvian fissure ends, as well as that fissure in the temporal lobe ends. So the one where the Sylvian fissure ends is the supramarginal gyrus, whereas at the back, that is the angular gyrus, which caps a sulcus there in the temporal lobe. And that's your occipital lobe there. So everything else that is not colored down here is the occipital lobe. So speaking about that sulcus here, so that consistent sulcus now divides the superior temporal gyrus from the remainder of the temporal lobe. So that's superior temporal gyrus, and that's the middle temporal gyrus because there is another sulcus down there. And then finally an inferior temporal sulcus. As you will see, and I'm going to reiterate, so these are all constructs. Who is to say this is temporal and not parietal? Because they are apparently continuous in terms of the fibers inside. Who says this is temporal and this is occipital when the fibers inside are actually continuous? So just remember these are all constructs. So as far as OS 202 is concerned, we're more concerned with areas and not actual gyri, because to the neurosurgeon, it's still different. That's why they do some stimulation during the surgery to really test which areas are for which function. Okay, so that's completing the picture now. Temporal lobe with its superior temporal sulcus, which is the sulcus that we follow to find that angular gyrus here in the parietal. So that is the superior temporal gyrus. And then you have an inconsistent, as you can see, a broken up sulcus down there, which will divide separate the middle from the inferior temporal gyrus. Okay, so look at it from the ventral surface now. So we've outlined all the temporal gyri down here, which are transverse running. So I mean longitudinal running. So from temporal to occipital here. The same pattern is continued when you look at the ventral surface of the temporal lobe here. So now you'll have some consistent looking sulci here. So the sulci I mentioned earlier, the inferior temporal sulcus, and a fairly long sulcus down here. Not as perfect as the central or the sylvian sulci, but more or less consistent in terms of where it is found, thus helping to demarcate two additional gyri here at the on the ventral surface of the temporal lobe. So this sulcus here, which runs from temporal to the tip over here, which is the occipital lobe already, is thus termed the occipitotemporal sulcus. So a structure over here which is important, which is actually another point proving that this is the temporal versus occipital naming is not really consistent with real world scenarios. It's actually one long piece of brain here. Where do you draw the line between temporal and occipital? There is no line here. Hence, this is called a lateral occipitotemporal gyrus, but we call it the fusiform gyrus instead, so that it's easier for us to remember instead of this longer one. But the longer name helps you anatomically, but functionally, the fusiform gyrus here is helpful for us to remember someone's face. No, so you can call it faciform, or to remember. So mnemonic. Fusiform is for faces, remembering faces. And then a tongue-looking gyrus here is likewise called the lingual gyrus, but anatomically, since it is a medially located temporo-occipital gyrus or occipitotemporal gyrus, so we give it the full name, medial occipitotemporal gyrus. But the lingual gyrus, this helps us to remember it better because it looks like a tongue, which will now help us now find an important area within this occipital lobe. So where do you draw the line? It's all, there's no line separating the temporal from the occipital here. So this important groove here is the calcarine fissure or the calcarine sulcus. Around the banks of this sulcus are the very cells that allow you to see. So vision is located here on the banks of that calcarine fissure. So this is called the primary visual cortex this time. and the remainder of the temporal lobe over here. So this part here, which is separate from that lingual gyrus here. So this is more prominent because it has a bump here that touches on the brainstem, the midbrain of the brainstem. That's called the parahippocampal gyrus. Now, if you remember, or if you've already forgotten about short-term memory use in medical school, the hippocampus is found inside this parahippocampal gyrus. So it just means the gyrus around the hippocampus. So this is the most medial portion of your temporal lobe. So just some schematics. So that's the inferior temporal gyrus laterally. You have that longer lateral occipitotemporal gyrus, or fusiform for short. And then the shorter one, which is the lingual gyrus, or the medial occipitotemporal gyrus, which technically you may or may not even see any sulci here separating them, is actually one and the same with this parahippocampal gyrus here. It is thus so named because of its location, but its contents, the hippocampus actually runs all the way back here if you dissect it.